Snow isn't the only thing in the air during winter. Germs are everywhere too. NCTV 17's Jordan Abudayyeh takes a look at the flu and how to avoid it.
Flu season started here in Illinois a few weeks ago, and the new year will be the peak of the season. Dr. Jonathan Pinsky, the medical director of infection control at Edward Hospital, lays out the predominant symptoms.
Fever, sore throat, fatigue that can last anywhere from a few days to up to a week.
From 2009 to 2011, H1N1 was the popular influenza strain, but this year there's a different type of flu that patients are dealing with.
The H1N1 predominantly affected younger adults and children because they predominantly lacked immunity to that, whereas the elderly population was generally immune because of previous similar strains from previous years. The H3N2 strain, it tends to affect all populations, the young and the old.
Those most at risk, people with chronic illnesses like asthma and diabetes, immunosuppressed patients, and pregnant women. Because no one is safe, the best way to avoid the flu is getting vaccinated. This year's vaccine contains strains of H3N2, so it should be very effective.
Even up to 1 in every 10 people may be affected by the flu to some extent, and 1 in every 100 people will be sick enough to have severe illness and be hospitalized. And approximately 1 in every 1,000 people will actually have severe illness that will result in a prolonged hospitalization. And I believe the risk of death from influenza is about 1 in 100,000.
If you have the flu, stay home from work or school and out of the public space. Cover your mouth when coughing or sneezing, and always remember to wash your hands. I'm Jordan Abudayyeh reporting for Naperville News 17.
Doctors recommend getting your flu shot immediately, as it takes 2 weeks to build immunity.